The Health Inequality Framework is a framework that you can run alongside the engagement work you're doing to ensure that you're being equitable in the way you're going about it and make sure that all the voices that need to be heard are being heard.
It will make sure that we're thinking about health inequalities and that we're engaging with people who experience health inequalities in a systematic way, and also that we're doing that consistently throughout our integrated care system.
It's going to mean that we really focus on hearing those voices that are sometimes unheard. So we do a lot of work to work with marginalised communities and often called underserved communities. We want to make sure that we serve them to help them to reduce inequalities in their areas.
I think it's flexible, it can be adaptable, and I think you can make the framework work to the best of its ability within your own organisation.
The framework is actually looking as if it's going to be quite adaptable and quite flexible. I think when we went through the pilot phase, it felt a little bit inflexible, perhaps, but it looks like it's been redesigned in such a way that we can dip in and dip out of it as appropriate for the different projects that we want to use it for.
So the framework was developed in partnership. So different ICSs across the country worked in partnership with local stakeholders.
It's really lovely when an organisation says that it wants to co-design something and then it actually does. So there were people with lived experience involved, they involved system leaders, they involved people like myself who do community engagement as their job, and we came together, we worked really closely together. I was delighted when we got a chance to test it and pilot it in Gloucestershire.
We tested it with people who work on a very strategic level, but also those who work operationally, the people who are kind of doing the doing in terms of services and planning projects.
Everyone within an organisation would benefit from using this framework.
I want to use it in different ways. So yes, I think we will use it strategically, but equally I do want to use it for very specific projects as well. Because it's new, I kind of want to try it in lots of different ways to see what works best.
It can only help to improve the offer and the services that we then develop, because we need to be working more in partnership. So for me, my role is personalised care and co-production. So I'm really passionate about genuinely co-producing, and I think this is a really good start and a way in.
It's something that can be used and should be used continuously as part of a continuous improvement cycle, and lots of different partners can be involved in using it.
I know that ICSs have got really different populations, different challenges, etc. And I think there's built in enough flexibility to enable everybody to give it a go using the framework.
I think if you're engaging and involving communities, it's really important to use the framework, especially to address those health inequalities. You know, we could also get the buy-in with our community and voluntary sector organisations. We have something called an alliance where it brings together over 8 different charities and communities, and I think if we can give them the tools as well, it can then feed into the work that we do as commissioners.
When we applied the framework, we saw a lot of things that we were doing reflecting the framework, the stuff we do naturally, but then there was some other bits where we could kind of improve on that work. And that's coming from a really experienced team in a big organisation, so if it can help us, it's definitely going to be able to help other partners as well.